Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about granulomatous disease of nose. The second one is Rhinosporidiosis. Before this we have learned about rhinoscleroma. Okay. So Rhinosporidiosis. It is recently classified as aquatic protozoal disease. Okay, aquatic protozoal disease. The causative organism is Rhinosporidium seaberi. Rhinosporidium seaberi. Since it is aquatic protozoal, so it is mainly waterborne disease. Okay, so the mode of infection is waterborne. Prevalence is more in south of India, Pakistan and Sri Lanka, whereas rhinoscleroma was more prevalent in north of India. Okay, so now coming to this, Rhinosporidium seaberi multiplies in layers of epidermis. Okay, suppose this is the layers of epidermis, so they'll multiply within this, and it will form a red polypoid mass with whitish dots. Okay, so this is a red polypoid mass with whitish dots. This is called strawberry like mass. Okay, so simple. The first Rhinosporidium seaberi, they'll multiply in the layers of epidermis with polyp mass and whitish dots. This is the vascular mass, and this bleeds on touch, and it causes nasal obstruction. So the features will be same. There will be bleeding from the mass. Okay, rhinoscleroma was very hard, woody hard. There was not so much of bleeding as such. But here, there will be bleeding from nose, nasal obstruction, there will be difficulty in breathing, and cosmetic concern. Okay, so what are the signs? There is a characteristic appearance, leafy, pink or purple polypoidal mass, studded with white dots representing sporangia of protozoa. Okay, so you have to say the shape, leafy, color, then polypoidal mass with whitish dots. So strawberry like mass. In histopath, what you'll find? You'll find sporangia, that is double-walled sporangia with spores are seen. Okay. Culture is not possible for Rhinosporidium seaberi. Very important. Culture is not possible for this, whereas culture was possible in rhinoscleroma case. Okay. So what is the treatment? Treatment is surgical excision of mass with cauterization of the base. Dapsone can be given to reduce recurrence rate, since it is have very high recurrence rate, so dapsone can be given. So this was about the rhinosporidiosis. Coming to tuberculosis, in tuberculosis also we'll see this granulomatous growth. So it is caused by Mycobacterium tuberculosis. Okay, symptoms in again nodule followed by the ulcer, then perforation. Okay, so in tuberculosis also you can see this first nodule will be formed, then it will be ulcerated, and then perforation can be. And most common part is cartilaginous part. So treatment is anti-tubercular therapy. In low grade tuberculosis infection, that is lupus vulgaris, will find apple jelly nodule. These nodules blanch on applying pressure. Okay, in low grade tuberculosis infection, we'll find lupus vulgaris, that is like apple jelly nodule, and these nodules blanch on applying pressure. Other granulomatous diseases due to Mycobacterium lepra, that is leprosy. Here it is mainly for septal destruction. Tuberculosis is for cartilage mainly. It is for septal destruction known for. Here you will find saddle nose deformity plus alar retrosion. Okay, so this is a typical feature of lepra nose. You can see in Google what lepra nose looks like. Okay, so variants in tuberculoid leprosy, you will find granulomatous reaction present, but they have good cell mediated immunity. In lepromatous leprosy, they do not have good cell mediated immunity, so granulomatous reaction is not there. And in intermediate variant, it may not be seen. Sarcoidosis. In sarcoidosis, there is non-caseating granulomas. Okay, non-caseating granulomas. This is a multisystem disorder. Here again, we'll find strawberry-like appearance of nasal mucosa. Where else we will see strawberry-like appearance? Rhinosporidiosis. Here, strawberry-like appearance of nasal mucosa, suggestive of sarcoidosis. In histopath, what we'll find? Lupus pernio. Okay, reddish blue lesions seen. Treatment is again steroids and immunomodulators. So these are about the granulomatous disease of the nose, but most important as rhinoscleroma and rhinosporidiosis. Thank you so much.